Welcome back to Medscape at ADA 2024, where Dr. James Kim, primary care physician from Calgary, Alberta, will be joining me, Akshay Jain, endocrinologist from Vancouver, Canada, in deciphering what was the key highlights at the ADA conference and bringing our own clinical twist into what the relevance would be for people like you and I to take away back to our clinics. So welcome back, Dr. Kim.
Well, thank you very much. It's nice to be back.
So it's interesting. This was a diabetes conference. So obviously we are very pancreas focused, but at this conference, we went outside our general area of territory there, going outside of the pancreas and delving into other organ states. There was some stuff about the liver, but what I found very fascinating was some data regarding the effects of incretin therapy on the lung, and in particular, some of the restrictive lung disorders. Dr. Kim, you attended these sessions as well. Can you tell us a little bit more about the results that were discussed?
Yes, so this is really interesting field. The moderator of the session actually went up and said, there has been no times in previous or any of the ADA sessions where the lung issue was actually discussed. So this was the first time ever. And they actually had some of the world leaders in this field. So it was really awesome to see them. So just to paint a bit of a picture of these, what we will call obese asthmatic patients, they are challenging cases because, as you know, the primary medications, the therapy for any asthmatic patient is actually inhaled corticosteroid. But these patients who are obese actually have quite a bit of a steroid resistance. Therefore, they land up being on many medications that sometimes are off-label, and many of them actually land up being on biologics as well. So therefore, the respiratory world has been seeking therapies for these obese asthmatic patients who are likely to be steroid resistant, because these people are also likely to land up in an oral steroid as well. And Dr. Jain, you know the effect of the steroids a lot better than I do, and it's like a laundry list. And we really don't want our patients to be on oral steroid. Now, in the past few years, the GLP-1 has been studied quite extensively in the lung, especially in the world of asthma and also in COPD as well. What's really fascinating is that the GLP-1 receptors have been found to be quite abundant in the airway. Some studies actually show that the highest concentration of GLP-1 lies in the airway. Some studies actually said that it's the third most common area to find the GLP-1. So it is not a surprise that the GLP-1 receptor agonists are being studied quite extensively in managing the airway, especially airway inflammation in asthma and COPD patients. The preliminary data have been quite encouraging. They also discussed that there are new medications coming out that seems to be incretin based. So we'll wait to see what those studies show. There are two current phase 3 trials being held at the moment. One is using semaglutide sub-Q of 2.4 milligrams. And another one is using metformin to reduce the airway inflammation in these asthmatic patients and also in some COPD patients. So we'll really look forward to these results.
Right. So that's really important to note, right? Because we see that there is a high density of these receptors in the airways. And hitherto, we had no idea about what the overall effect would be. And now we're looking at both, as you mentioned, individuals with obesity who have asthma. So there is both the restrictive and obstructive components in the lung that are coming into play here. So I think from an endocrinology perspective, I'm thinking that this could be multiple effects of the GLP-1 receptor agonist, where on one hand, you're managing the obesity and you're working along that line. And on the other hand, it could be having local anti-inflammatory effects in the lung. And hence, there could be potential improvement in the overall pulmonary function of these individuals.
And actually, we are seeing this in primary care. So ever since I found out about these information, I have started numerous patients who are obese asthmatic patients that do not have diabetes and started them on GLP-1 therapies. And their pulmonary function tests have improved significantly. As a matter of fact, one of my personal friends was severe asthmatic patient. She lands up being on the oral steroid about 3 times a year. And there was even one day I saw her in one of my class where she was like dyspneic. She was short of breath. And I introduced her to one of my colleagues who's a respirologist who's very much into the impact of the incretins and asthma, and started on GLP-1 receptor agonist. And now, I mean, she did lose about 30 pounds of weight, but now she is labeled from severe asthmatic to now mild asthmatic. Her pulmonary function test is completely normal. She hasn't touched the steroid for a couple of years now, the oral steroid, I mean. So that is a huge success story. And I'm seeing that even in my own clinic as well. So it's a huge, huge win for the respiratory world.
Yeah. And I think from an endocrinology perspective as well, if we are initiating GLP-1 receptor agonists or medications in that class where we use it for management of obesity, sooner or later, we do hit a stage where people will plateau with their weight loss. They won't have any additional weight loss. We do tell individuals at that time that the fact that they're able to maintain the weight loss still means that the medication is working from the obesity perspective. But I think for individuals who are also having asthma, it would be a good point to tell them that it could still be having potential effects on reducing inflammation ongoing. And hence, even though they may not be losing any additional weight, it would still be helpful to continue on these medications from a pulmonary perspective.
I think right now that these pleiotropic effect of the GLP-1 is absolutely mind-blowing. I actually mentioned that in one of my respiratory presentations to a whole bunch of respirologists that diabetes is taking over the world, including the respiratory world. Well, you can kind of imagine what their faces were like. However, they were quite impressed at that, and they were very excited with what these two phase 3 trials will show.
Yeah. Well, I think, based on the ADA 2024 conference, GLP-1 receptor agonists continue to be the gift that keeps giving. We have got its effect on diabetes, obesity, kidney function, liver protection, lungs, Alzheimer's. We saw some sessions about its potential use in people with alcohol misuse disorder, gambling problems. So clearly there's a lot of research that's being done with these agents. And perhaps when you and I talk about ADA 2025, we might be able to talk about some more pleiotropic benefits outside the pancreas. Until then, please do check out our other videos from ADA 2024. And thanks for joining us again, Dr. Kim.
Thank you very much for having me.